With the regular focus on the global spread of coronavirus over the past 18 months, this presentation is going to address some of the issues with hotel quarantine in Australia. With nearly 4 million dead, the coronavirus has spread to nearly all parts of the world. By the end of last month, there has been over 666,000 deaths in the United States alone. There have been over 180 million cases globally and nearly 4 million deaths. The worst hit countries at the end of last month have been the United States, Brazil, India, Mexico, and Peru. Governments are taking a wide range of measures to tackle the COVID-19 outbreak. The Blavatnik School of Government at the University of Oxford works to track and compare those government responses to the coronavirus. Information on which measures governments take and when can help us understand the responses in a consistent way, aiding efforts to fight the pandemic. The data is collected from publicly available information by a cross-disciplinary Oxford University team of academics and students. The first 7 indicators, S1 to S7, evaluating policies such as school closures, travel bans, etc., are recorded on an ordinal scale. The remainder are financial indicators such as fiscal or monetary measures. There is a working paper describing all the various data sources on their site. A later version now includes vaccine prioritisation, availability, and the financial support to get vaccinated. The figures on the chart on the right are for Australia on the 11th of July 2021, giving a stringency index of 68.57. While Australia has avoided the major implications of the pandemic due to our island status, we haven't been completely immune. Across Australia, there have been 910 deaths from 30,457 positive cases in Australia at the end of last month. Victoria has taken the brunt of the pandemic in this country so far. There isn't a comprehensive list of quarantine hotels, as not all states choose to publish them. I've put together this partial list with their occupancy numbers. Most of our outbreaks have originated in hotel quarantine, with all states except Tasmania and the Territories having had outbreaks. While New South Wales has had the most failures, Victoria has had the most per 100,000 travellers. The Australian Bureau of Statistics started releasing a range of products and data sets to assist economists and academics in understanding the economic costs. While not all industries have been similarly impacted, this is predicted to get worse across the board. Some of the main points from the previous slide and the ABS survey are that the impact is mostly from reduced local demand. Also, while professionals, scientists and tech services have been the least hurt so far, that impact is predicted to grow from 21% to 78% loss. The federal government has already allocated $66 billion. This is now being supplemented by a new disaster relief payments. Then there's the cost of paying for the hotels for permanent occupancy availability. Victoria pays $1.6 million a day for hotel quarantine facilities. As of today, New South Wales is currently costing their own JobKeeper program and other support packages. This report recommends that the federal government should create, fund and run end-to-end quarantine facilities in each state. Information on the quarantine programs should be easily accessible to travellers on the federal and state websites so that travellers can understand the requirements and be prepared for the experience. Travellers in quarantine should have access to timely decisions, reviews, and a complaints mechanism with an escalation option. We should also consider appropriate risk assessments for travel bubbles with cohorts that are less affected. Thank you.